Hi everyone, Chitrali here.
Okay, so Chaitrali, are you willing to volunteer for the therapy today?
Sure, yes.
And would you be okay with the therapy session being viewed by other people on the internet?
If it helps them, yes.
Okay, it is gonna help them. They will learn therapy. At the same time, this would be streamed on live, streamed on YouTube live, and probably the session is gonna be there forever. So is that fine?
Sure.
All right. So
yes, it is. Yes.
Absolutely amazing. So thank you so much. First of all, I want to thank you for joining us and giving us an opportunity to learn therapy, specifically REBT. All right. So Chaitrali, what problems would you like to work on in today's session?
See, basically, if I can take a minute to explain where I was before to what I have come to. If that's okay, Doctor?
Absolutely, yeah.
Yeah. So I used to be a very, very successful professional. I have worked across quite a few countries across the world, about 14 different countries I've worked. I had a very successful career until I had some issues with personal relationships. And my mind started, completely unraveling after that, completely dismantling itself. And I over the past 8 to 9 years, my confidence level has decreased substantially. I used to be extremely confident about everything. I still think I'm a fairly intelligent person, but I can't seem to get anything done anymore. I took early retirement. I had always planned for early retirement by the age of 40, but I had to take it on absolutely critically urgent state about 2 years ago at 38. Because of the fact that I just couldn't function normally anymore. I used to dread receiving any phone calls. I used to dread, attending meetings or taking on any responsibility because I used to be scared about failing all the time. And in the past 2 years, I've pretty much not done anything. And it was so bad that I called up my partner one day in the middle of her work day, and I was at home. I didn't go to office that day, and I just called her, gave her an SOS call saying that you have to take me to a doctor because things are so bad that I might hurt myself. And immediately that evening, I was taken to a doctor. I was in medication for about 5 to 6 months. That got me out of the suicidal thoughts phase. But I was suggested REBT counseling. However, I couldn't go through with it. It was recommended, but I could never get myself, to go through with it, honestly. And eventually I discontinued the medication, but I never went through with all of the treatments that were necessary. These days I find myself again in a state where I've retired. I'm at a stay-at-home fur mama. I have 2 dogs who've helped me get through this, really bad stage in my life. But besides taking care of them, I don't really do anything around the house. Everything is done by, my partner, and I don't find the urge in me to kind of, do what is needed to kind of, keep the house running, or even to get back to doing something useful or purposeful in life.
All right. Okay, Chaitrali, give me a moment. I forgot to connect my charger to the laptop, or else this will disconnect in a minute.
Sure.
So what I gather from your discussion is that it all started with a setback in the relationship, right? And then it affected your profession, and then it started affecting your other functioning in many ways. You also had what we call as suicidal depression once, and you took medication. You completed the course of medication, but you did not do the REBT sessions that were recommended.
Yeah. I was told I need to go through REBT or CBT.
Mm-hmm.
I don't remember it well now, but yeah,
No problem.
they were.
So, cognitive behavior therapy and REBT are more or less synonymous. REBT
Okay.
is the most original cognitive behavior therapy, and what today is called CBT is actually cognitive therapy.
Mm-hmm.
It's an offshoot. I would say REBT has come first a decade earlier, and then came
Mm-hmm.
CBT. So we will be doing REBT with you, and which is a cognitive behavior therapy. Now let us set some.
And just one more thing to clarify. Even though the real unraveling of what I was happened 8 or 9 years ago, I have a feeling that I've not always been the extroverted, happy self that I have portrayed to the world all my life, because until I was 13, I used to speak with no one except my mother and brother. As a child, I used to think of killing myself, even though
Okay.
there wasn't really a very strong kind of push on any front, except for the fact that my brother was treated more special by my grandmother than me, and she used to really make me work at home as against all my cousins and stuff. So there was that feeling of disparity, but there was nothing really that was abuse in any form,
I
just
understand.
to
Right. So
clarify.
you probably had depressive symptoms since childhood, right? Maybe 13 years of age.
No, at 13, I actually consciously changed myself from being that extremely quiet and introverted person to being the complete polar opposite of being extremely extroverted and very confident and pushing myself out into the world. I changed, at 13, and I was very, very highly functional until 34, 35.
All right. Okay. Fine. So, Chaitanya, let us set some goals for therapy. And let
Sure.
me socialize you with this model of REBT is that it is more present focused and problem oriented, which
Sure.
means that we may not need a lot of details about past, but we
Sure.
may need a lot of details about your current situation. But I would rather focus on the way you think mostly and what you do. So,
Okay.
I would be interested in your thinking, feeling, and what you do more than I would be interested in what happened, right? So, I
Okay.
may
Sure.
frequently refocus the discussion to something that is relevant to therapy than
Sure.
something that is very probably crucial that has happened in past. So that does
Sure.
not mean that I'm not interested in the problem, but it's just that we
Sure.
want to make the whole session more efficient. So would you be okay with me frequently refocusing the discussion to relevant parts?
Sure. Absolutely.
Excellent. And counseling does not work. You have to make it work for you. And I'm only going to be your coach who will teach you how to, break certain habits, break certain patterns and cycles.
Sure.
What happens in depression, right? So today
Sure.
we're going to discuss about depression. And before we start, I think it is important for you to know that I had chronic depression, and it's been more than half of my life that I think I had depression. It started very early in the early years of 7 years of age, and I don't remember a happy day that happened. As you mentioned, there was no abuse, there was no bad childhood. I
Hmm.
was the youngest sibling in among three, so as I grew up, depression in itself as a disorder shaped my view about who I am, what I am, my view about the world also, and it felt
Mhm.
depression again. So depression as a disorder, I think I had pretty early in life, and then got treated very late. So happens, and I still do get what we say as small lapses, but every time I deal with the depression with the techniques that I'm going to teach you today, I'm
Mhm.
more and more skilled in dealing with depression, right?
Sure.
Do you want to be skilled in dealing with every lapse of symptoms or every recurrence of symptoms? Would you want to be more and more skilled?
At handling them myself, yes.
Yeah. So you're going to be your own therapist. Now, I'm very sure that one session is probably not going to be very, very sufficient for you. So I would strongly recommend that you follow up with another REBT therapist
Sure.
for the session. But let's focus on a few goals in today's session. What
Sure.
do you want the outcome of today's session be?
You know, for all my life, I have had this imposter syndrome. Even when things were working for me, I thought I never deserved it.
Mm-hmm.
And now that things are not really working, I'm not functional. I still feel like, you know, I don't deserve anything good that's happening in my life.
All right.
And I honestly don't have anything to complain about in my life currently, but I constantly feel anything good that's happening, I don't deserve it. And
But how is that a problem?
I want to address that basically.
How is that a problem for you?
uh, I just push away what you know, whatever good is happening. I push that away, thinking that I don't really have any claim on it. So if there's someone who's showing love, I kind of will push that person away. If yeah,
I hear you. So and when you push these things away that are actually significant for you, so you
yes,
also deprive yourself of the pleasures or the advantages of whatever you have pushed away. Is that correct?
true, true.
And does that worsen your depression or improve your depression?
It worsens it.
So do you see a cycle?
Yes, I do. I definitely do. Yes.
So it starts with a thought probably that I don't deserve, and then you push it away, so you don't get it, and then your depression worsens. And the more your depression worsens, it would probably worsen your thought as well, or make this thought even more intense that you don't deserve it.
Sure.
Sometimes it also happens that we deserve to be rejected, we deserve to be to fail, and this thought that I deserve to be rejected and probably going to be rejected also becomes a self-fulfilling prophecy, because we slow down our efforts towards achieving it, and then see what I had predicted actually happened, and that worsens or deepens your conviction thought that I knew this is going to happen. I knew it because I don't deserve it.
Mm-hmm.
So you see a cycle here that a non-deservingness leads to avoidance. Avoidance leads to loss. Loss leads to reinforcement of the belief that you actually didn't deserve it, therefore you didn't get it.
Mm-hmm.
So instead of
Yes.
you don't deserve, if you were to think that, do I want it?
Mm-hmm.
And if it's going to help me, then maybe you would go for things that you really want, they are significant for you, and take out the deservingness from this.
Mm-hmm.
If there was no concept of deservingness,
Mm-hmm.
if you want it, if it is ethical, if it is helpful, you would go for it probably.
Yeah, but often I then feel that, isn't it too selfish, you know, to keep taking from someone without really being able to reciprocate, you know, without being able to do the same things for the other people, or you know, be able to provide for the needs of others, you know, and just take it when I don't deserve it.
So one thought pattern is I don't deserve it, which probably would lead to feeling depressed that I don't deserve it. And if you still get it, even if you don't deserve it, then you feel guilty because there is another thought that I got it even when I didn't deserve it. Is it correct?
That's true. That's correct.
So this way or that way, you feel a disturbing feeling, which keeps
Yes.
you in the loop
Yes.
of avoidance and staying depressed and deprived.
Yes.
Okay, right. Now I see certain patterns, and then we're going to break these patterns. Are you going to help me break these patterns, or at least first understand how these patterns develop and how to break these patterns?
Sure.
All right. So which of these two feelings would you like to work on today? One is a guilt. Another one is feeling depressed when you think that you don't deserve.
It's a tough choice to make, but I think the depression.
Oh, wonderful. Okay, that's a good choice. How do you feel about being depressed for so long?
I feel it's not me. I keep going back to the old me, who was very energetic, who was excited about life, who was optimistic about every little thing that I did. Even when things wouldn't go my way, I kind of knew something better was around the corner. I miss that. I hate being the kind of person that I am. I keep thinking that, you know, that I've lost something that was very valuable. That hope, that optimism about life. I keep feeling that I let it go. And it's not a good place to be, because I keep thinking about the old me, and that I would like to be the old me.
Yeah, this again sounds very depressive to me, that, I lost my real self. And you mentioned one thing, that you keep thinking about the old self, right?
Yes.
So there is a sense of loss of the original self. Now, Can you say that you feel depressed about the current state of being depressed?
Yes, I do. Yes.
Okay. So we have three issues. Number one, a primary depression about something, that, I don't deserve something. Second, depression about depression, that I lost my original, bubbly me, or the positive me, right? So we have two levels of depression here: primary depression and secondary depression. Which one would you like to work on today? Depression about depression, or the depression about your life events, or whatever?
I think about the depression. I mean, the depression about the depression, because it's just something that has incapacitated me. I can't seem to move ahead.
Okay, that's a great choice. So could you write down today's goal of session would be dealing with depression about depression?
Okay. Hold on, I need to get.
Yeah, there is a question. Till then, I'll answer it. The first level of depression would be depression life event, that I do not do certain things.
Can I get a pen?
Depressed about it. And the second level is about depression, that I lost positive self, and therefore it's a great sense of loss.
Give me a minute, doctor.
Sure. Of course, there are books you could go for very basics of REBT. There's a book called, if you're a practitioner, Surabhi, then there's this practitioner, amazing book. Not a practitioner, then there is another book called as Life Coaching by Wendy Tridden and Michael Neiman. Are you ready, Chetrali?
Yeah. Sorry, can you tell me the name of the book again?
I'll tell you later. So
okay.
To your therapeutic.
Yes, I'm back on.
Same later. Okay, let's stick to Chetrali's discussion. So dealing with depression about depression. This is a goal for today's session. Is that correct?
Yes.
So you want to feel how about depression now onwards?
I don't want that to be a constant thought in my head. I don't want to be incapacitated. And I want to be able to make plans for the future. It could be as simple as, I want to get up and tend to my plants in my garden. Could be as simple as that. But I want to be able to do that.
Okay. So, let us say that you're depressed about depression. People could be depressed about anything. For instance, if I had diabetes, I might get depressed about diabetes, right? And that will interfere with my outcome of diabetes. For instance, I'm hopeless about diabetes. Therefore, I do not take the medication of diabetes and it worsens, right? So depression about diabetes interferes with recovery from diabetes. In a similar way, when you're depressed about depression, it's going to affect your recovery about depression as well.
Mm-hmm.
Is it correct? So we have choices about how to feel about depression. For instance, you may feel nothing about depression, that, oh, this is okay, I enjoy what is happening, depression is good, or feel nothing about it. Another one is depression about depression, like you feel incapacitated by depression, or probably frozen by depression. And third is feeling sad and disappointed about depression, but not depressed about it.
Mm-hmm.
Which one would be helpful in the long run? Feeling nothing about it, feeling sad and disappointed, but not depressed. But and then third one is depressed about depression.
Just not being affected by it.
And that can happen with sad. I feel sad about depression. Too bad this happened.
Sure. Yes.
Does that make sense?
Yes.
Okay. So our goal is to not feel nothing about depression. Our goal is to feel sad but not depressed about depression.
Mm-hmm.
Sadness is a healthy reaction to a great loss.
Mm-hmm.
Not feeling anything would be unrealistic to a great loss.
Sure.
About depression, although normal, I would say, although understandable, but it is not a helpful reaction to depression, to the loss.
Mm-hmm.
Right? Okay.
Sure. Yeah.
So could you give one specific incident where you felt about being depressed?
Oh, just yesterday. There was some simple thing to be done. I think I had to fill up water bottles in the house, so that we could have ready access, whenever we wanted. And I just wanted to be alone. And when my partner asked me to do it, I just snapped at her, and I went and locked myself into the room again, just because I wanted to be by myself. And it was just, I felt so guilty about it, about having lost it on her. But, it was just that I was feeling sorry for myself, for the fact that I'm feeling low and I can't, just continue to feel that.
Very valuable information in a short period of time. So can we divide this information into 3 parts?
Mm-hmm.
So I want you to make 3 columns, A, B, and C on the paper.
Mm-hmm.
Are you writing stuff? Because, you will be able to watch this objectively, what you have written. And we'll also rapid progress in terms of, dividing the information and then looking at it objectively.
Okay.
That? Awesome. So A stands for trigger.
Mm-hmm.
B stands for thoughts. And C stands for reaction.
Sorry, C stands for?
Reaction.
Reaction.
Technically, A stands for antecedent event in REBT. Who are therapists, I would like to tell them A for antecedent event, B for beliefs, and C is consequences. But we'll keep the normal or the colloquial lingo here. The trigger was, you were demotivated to fill the water bottles. Is that correct?
Yes.
Yeah. Can you write this down? Demotivation is the A.
Okay.
Excellent. And then C, reaction. How did you feel about being demotivated?
I just wanted to withdraw into a shell.
Mm-hmm. And that feeling is how?
No, it came out as anger, because I couldn't do that.
You couldn't do what?
I couldn't just withdraw and sit by myself. Instead, I was expected to kind of do this chore in the house.
And then what happened?
I lost it. I just yelled.
So at what point did you feel depressed about being depressed?
After I'd closed the door and withdrawn into my room, I felt horrible about it. That I'm doing something to someone that doesn't deserve it. My depression is causing this.
Yeah, the actual trigger was you snapping out at your partner. Is that correct?
That's right. Yes.
Again, that snapping out, snapping at my partner.
Mm-hmm.
This was the actual A trigger.
Mm-hmm.
If you did not snap at her, would you still be depressed about being depressed or no?
Yes, I would still be, but yeah, that snapping made it worse because
so the most
I was doing something that I didn't want to, and yet it came out.
All right. Okay, I got it. So the snapping was the most crucial part here, right? And
Yes.
then depressed, or you said guilty about snapping out, right?
Yes.
Guilt. Write down C, guilt.
Okay.
Did you write down A, snapping out?
Yes, I did.
And C is guilt. And what did you do after feeling guilty?
Nothing. I just sat by myself. Of course, I went and apologized later, but for that moment,
you didn't
I
know.
just.
And you sat by yourself.
I cried about it. I felt horrible about it.
Write down cried in the C section, cried.
Okay.
Anki kaitri kelas. Remember.
Mm-hmm. Yeah, I just felt horrible that I really felt guilty about the fact that I'm doing this to someone, right? I mean, who doesn't deserve it?
For how many hours?
For a good half hour.
Okay. So can we say that you ruminated for half an hour?
Yes, I did.
Kudlis na tower.
Yeah, I did.
Okay. So write this down in the C section. Ruminate. Now this is very important. Why is rumination important? Is we don't notice that we are ruminating, and the more we ruminate, the worse our mood gets. It serves no practical purpose. But you will that every time you ruminate, which appears almost automatic, that you do no problem solving, and even if you do problem solving, it comes with a very heavy load of bad mood. So rumination worsens your mood. Do you know what actually literally rumination means?
Yes, it's when a cow regurgitates its food.
And then they keep chewing the cud for a long time. So we call it Kavantha Karna in Marathi and Jugali Karna in Hindi. So they chew it for hours and hours and hours, and human beings do the same thing for many hours. You did apologize to her, but the same could have been done without guilt. Is that right?
Yes, I could have, yes.
So guilt, although it's understandable, but it didn't serve a very good purpose. What if, instead of feeling guilty, you were to feel only responsible but not guilty? Would that have helped?
I don't see in this situation, doctor, how I would have not felt guilty, about yelling at someone. I mean, it's honestly something that jars me. I wouldn't like to be yelled at. So it's wrong for me to yell at someone, right?
I hear you. So I'm not saying that, you don't feel anything about yelling, right? So you had again three choices about how do you feel about yelling. One is feel nothing about yelling, like this is justified, she deserves to be yelled at. So this is one, indifference towards yelling. Second would be feeling responsible for yelling and not guilty. And third one would be guilty. Now, responsible and not guilty means I own up my behavior, but that does not mean I am a bad person.
Sure. Okay. Yeah, I see what you mean. Yes.
Great. So would you want to feel responsible but not guilty now onwards when you yell? Because you're going to yell some other day, given the fact.
Sure.
Right?
Yeah. Yeah.
Great. Okay. Now, guilt, why am I focusing on guilt? Because it forms a part of depression. Depression is a complex, I would say, I'm not talking about clinical depression. I'm talking the feeling depression. The feeling is a cocktail of emotions that includes extreme sadness, anxiety, guilt, shame, helplessness, hopelessness.
Yes.
Them together, shake it. Now you have a perfect drink, depression. So we are dealing with one feeling in depression, which is guilt.
Mm-hmm.
You see that we are focusing on only one feeling. So you may have to work on other feelings as well in depression, right?
Mm-hmm.
I sense another feeling that you say, I feel incapacitated. So that means I think that I'm assuming that you also feel helpless at times.
Yeah, I do most of the times. Yes.
We're going to talk about it in some other sessions. So what made you guilty at that time?
Can you say that again? Your voice broke up.
What thoughts made you guilty at that time?
Just this lack of control on myself. That the urge to withdraw was so strong that it made me react in a way that I don't want to.
Okay.
It's
That
it's
lack.
that lack of the inability to define how I want to behave or how I want to express myself. I don't want to yell. I want to be able to just say that I'm not in a good space and I want to withdraw, right?
Okay,
But
write this down in the B section quickly. That I want to say.
mm-hmm.
I want to say what? That I'm not in a good mood.
Yeah.
And no, this is not sufficient for depression. You said something more to it. And I want to say something, how I feel.
Mm-hmm. Yeah, and be able to to be able to process on it without really taking it out on someone else. It almost felt like it was an easy target for me at that moment, and I hated taking it out on an easy target
I, wa-
rather than.
I wanted to express myself appropriately, and I didn't. Is that correct?
Yes, that's correct.
It is not I didn't. I couldn't.
Yes.
I was
Yeah,
unable. What you were saying right now.
that's correct. Yeah.
Can you write this down? I wanted to express myself and I was unable to. I'm always intrigued by this script that many people have in their head. I was
Mm-hmm.
able to, that itself makes us feel so helpless that, I was unable. For instance, let's quickly check if you were really unable to or you chose not to. See, I am unable to fly. Is that true or a false statement?
It's true.
Yeah, because I don't have wings. I am unable to get pregnant. True or
That's false, right? I mean, if I take the action, I should be able to.
I I have a bed and a mustache.
Actually, you. Okay, you.
I am able to or I am unable to. Tell me.
Yeah, I'm assuming unable to. Science has progressed, but yeah.
I'm unable to because I actually lack the ability, right? No matter how hard I try or someone else tries, and
Sure.
able to. So that is true inability. But I'm unable to get up at 6 o'clock in the morning to work out. Is this true or false?
Obviously, it's false.
But I choose not to. This is true,
Yeah,
correct?
true.
How about you too? You wanted to express yourself appropriately.
Mm-hmm.
Were you unable to, or you chose not to?
I it I felt unable to at that time. It
So
it just
I
it
feel
just was a reaction rather than this thing. It was, yeah. I see what you mean. I can control my reaction,
no,
but
you have the ability.
I do have the ability to. Yes.
You don't have the skills. I'm gonna teach you, but the ability.
Okay.
Does this make sense to you?
Yes.
I am able to, right? I am able to,
Yes.
but at that time I chose not to because of lack of skills, lack of knowledge, whatever, or my emotional
Sure.
level. And the best explanation is I'm human, so this happened. So write down a downward arrow, draw a small downward arrow there. That what did you write first? I wanted to, but I was unable to, right?
Yeah, wanted to express myself appropriately, but I was unable to.
And let's assume that this is true, that you were unable to. What does that mean?
The inability to control myself.
Mm-hmm. Okay, that's the thought. Write this down. Inability to control my, in the B section, write this down.
Mm-hmm.
A downward arrow, and it means inability to control my
reaction.
And worst case scenario, if this is true, then it means
behavior.
Yeah, what does that mean? If you are unable to control your reactions, then it means?
I don't know.
You know it.
Helplessness.
That's a feeling. That means you are what?
Handicapped.
I am handicapped. That sounds interesting. So can you write this down? I'm handicapped.
Sure.
Thoughts that, I absolutely should be able to control my reactions. Is it reaction?
Sure.
Behavior? What were you thinking?
I was thinking of reaction, yes.
So one thing is, I am handicapped if I'm not able to. Another thought could be, I'm just exploring. I absolutely should have full control on my reactions.
Mm-hmm.
Another, I can't tolerate any lack of control on myself.
Mm-hmm.
Or it's terrible that I lost control.
It's a hard thing, doctor, because
you have all of them.
Yes, but more so because of the guilt I feel later. Right? About
exploring what thoughts made you so guilty. One would be, I'm handicapped if I can't control my reactions.
Mm-hmm.
I absolutely should have control on my reactions. I can't tolerate lack of control, or it's awful, terrible that I lost control.
It's that handicapped feeling, that
okay,
it's something I want to do, but I'm unable to do it.
Okay, can you underline this handicapped? I'm handicapped.
Yes.
Now, as I suspected, this is the helpless feeling that I was talking about.
Mm-hmm.
So, the superficial expression is guilt, and even more superficial expression is anger. But the guilt has an underlying feeling of helplessness.
Yes.
Is that correct?
Yes. Part of me always thought that, that helplessness came from the guilt.
No, it's the other way around.
Yeah. I trust you since you've seen a lot of cases, but I always related to it saying that I just feel so.
We'll cross check.
Okay.
If in spite of not being able to control any of your reactions, say for instance, you were not to feel helpless but only feel inconvenienced, say for instance, too bad, I lost my cool today, too bad.
Mm-hmm.
That doesn't mean I am a handicapped person. Am I on my periods? Am I hungry? I'm human, such things happen. But I'll be careful next time. So if you were not to feel helpless but only inconvenienced, would you feel guilty?
It's a hard one to answer because I'm wired to kind of say that yes, I would feel guilty because it's wrong. What I did was wrong.
See, feeling helpless has probably another thought that I am handicapped. So let me if you were not to call yourself handicapped but just another human for snapping out or losing control, would you feel guilty?
Maybe not as much, yeah.
Correct. So the guilt has a component of downing yourself, which is I am inferior in some way.
Mm-hmm.
It falls into the category of what we call as incompetence beliefs, that I'm incompetent in managing my own reactions, and therefore I am handicapped.
Yes.
Is it correct?
Yes.
Okay, so we may have to examine this label that you have attached to yourself. I'm handicapped if I lose control on my reactions. How convinced are you on a 0 to 100 scale that you are handicapped if you lose control?
I think 90 on 100.
And when
That
you were when you were guilty, you were crying, how much were you convinced that you're handicapped if you lose control?
I think completely.
Oh, completely, right? So, which means that this conviction and the belief that you're handicapped if you lose control is leading to guilt,
Mm-hmm.
and not the actual event that you snapped out.
Yes.
Okay.
Yes. I mean, I was angry with myself about losing control, about uh, not about yelling, but not being able to control that.
Yes. So let us refine the ABC now.
Mm-hmm.
The A stands here. Can you write this down? A new ABC.
Sure.
Not a new ABC, but this is a refined ABC, I would say. A was losing control,
Mm-hmm.
B was handicapped, and C was helpless.
Yes.
He was helpless or guilty. Because it can give rise to both.
It was guilt,
Okay, fine.
for
So,
sure.
okay. So, do you think the losing control made you guilty, or is it's your own belief that you're handicapped that made you guilty?
Yeah, the inability to control. Yeah, that helplessness
Helplessness is
made me feel.
my question is A, losing
Mm-hmm.
control event
Mm-hmm.
that made you guilty, or your own thoughts about it that I am handicapped, the evaluation that you attach to yourself that I'm handicapped because I lost control.
Hmm. I mean, at that time, I definitely primarily felt angry with myself, or helpless about the fact that I couldn't control myself.
I like the use of word about the fact that you couldn't control yourself, right? I'm saying
Mhm.
not because of the fact, because there is a mediator in between, which is your own thoughts about it, that you are handicapped if such a thing,
Yes.
right?
Yes.
So, do you see the mediator that I am handicapped? This plays a very important role in your guilt.
Yes. I see where you're going. Yes, I see what you mean. Yes.
Amazing. So, why is this important? Because, our reactions are probably something that usually can be modified later. Like, they're not directly under your control, but you can change your reactions over a period of time. And events in themselves external events are largely out of control. So these things can keep happening over and over again. But if you don't want to feel guilty about it and feel responsible about the same thing, which probably is going to happen again, you may have to change the way you're thinking about your reactions. For instance, losing control is the event. How do you think about it will make a great difference in how you feel about it.
Mm-hmm.
So, would you like to examine if this belief is accurate or not accurate? That you're handicapped if you lose control.
Yes. I of course. Yes.
Hmm. Okay. Before that, can you quickly summarize what we learned so far?
So it's not the actual event, but basically how I think about myself that is, causing the reaction of feeling helpless or
This is
feeling like it's not in my control.
you're talking like an expert REBT therapist or a client. Have you been through REBT before?
Never, no.
Oh my god, like you're a smart girl.
I just shied away from it, even though I knew it was necessary. I couldn't get myself to go through with it.
No problem. So this always the time. Maybe this is a good opportunity. So bang on. Basically, A, B, and C. And what you learned so far is really mind blowing. You have a partner, and if she lost control, would you call her handicapped?
No.
Why not?
I actually don't know. Yeah, I mean, I don't know. I think there's this feeling of, the fact that, I have control over me, but not really. I don't know. I don't know. Maybe I just make excuses for others. I really don't know.
She is what for losing control?
No, I mean, honestly, if she loses control, I just withdraw into my shell and I take myself away from the situation.
You have to call her something, right?
To tell you honestly, it's just, it just pushes me to such a state that I'm more addressing what's happening to me, my reaction to her, than really calling her something. But yeah, I mean, I wouldn't call her. I don't usually lay any kind of blame on her or call her handicapped. No.
But what would you think of her? Not call her, but what would you think of her? She is what for losing control?
I don't know, short tempered.
Okay. Would that label help her?
No.
What label would help her? That she lost control and it only means?
I don't know. I honestly don't know.
You know it.
I don't know. She's
Superwoman.
just reacting to something, maybe.
Superwoman, what? What is she? She's a Avenger, Superwoman, what?
She's human, right?
That sounds good. Okay. So do you have double standards, one for your partner, another for yourself?
I never had thought of it that way until now.
Mm-hmm. And
but maybe I do.
Yeah, this is the root of the problem that, Twada kutta kutta, sada kutta.
Yeah, thoda kutta Tommy.
Yeah, अच्छा तू lose control करे तो तू human and मैं lose control करूँ तो मैं handicapped. What is this? Like I don't get this. Do you understand what is happening here? And you are more compassionate towards others, specifically your partner, but not compassionate towards yourself. I am not saying at any point in time that it is okay to lose control. I'm not saying that. I'm not saying it's acceptable. I'm not saying it's helpful. I'm not saying that needs to be dismissed. I'm saying that it is human to lose control.
Sure. Yeah.
Make sense?
Yes.
And this is so much in line with today's goal of the session, is feel responsible but not guilty. And that can only happen when you call yourself human and not handicapped for losing control. But at the same time, not saying that under the umbrella of I'm human, that it's okay to make mistakes.
Mm-hmm.
Okay?
Mm-hmm.
Now, your conviction in this new belief would be very, very poor or I would say weak. And we need lots of revising of this new belief to be deeply convinced about it. And the more you're convinced about it, the more you will feel responsible and not guilty when similar things happen in future. So would you write down a question that might help you convince yourself more next time? So write this down. If I lose control, how does it mean I am handicapped and not human who lacks a skill? The skill that I'm talking about is emotional regulation. You could improve with this skill that, if you learn how to manage your feelings well, and if you ever right, you would probably be able to have better control or regulation of emotions.
Yeah, I mean, if that mindset changes over time, of course, I feel it would be a little less intense. That self-blaming.
Like the word control, right?
Yeah.
Control is this. This is the air conditioner remote. If I press it, it's gonna switch. Okay, it got switched off. I press it again, it got switched on. This is control because I have a remote control of the air conditioner, right? But
sure, yes,
slightly different. We don't have remote controls. Yeah, we can regulate our emotions, we can regulate our reactions, our behavior, we can manage it, right? So we still want to hold on to that word, which is control, or you want to switch to another word, which is regulation and management?
Yes.
Excellent. Right.
Yeah. Yes.
So what is the question that you have written?
If I lose control, how does it mean I'm handicapped and not human, not human who lacks a skill?
Lacks a skill. The skill we are talking about is emotional regulation, behavioral management, and so on, right? So we can work in subsequent sessions if we choose to. But what was most helpful in today's session?
And just this thing that you brought out, right? That maybe I'm holding myself to a different standard as compared to everyone else around me. That I'm possibly being so absorbed in this, this reaction that I have on myself, that I'm not treating myself well.
Yeah, I'll show you another insight. Like the standards you hold for yourself and the way you rate yourself has a great disparity.
Yes.
And you think that the higher standards you hold, the better you will be able to match up. But that just suddenly, it just doesn't happen. I want you to get out of this rating game altogether. Like, hold high standards, fine, no problem with that. But the rating of self as inferior is something that is creating the problem.
Sure. Yes.
So just get out of this rating game. Human beings can't be rated. It's a royal waste of time.
One doesn't do it consciously, do they?
Sorry?
It just one doesn't do it consciously, right? I mean, it just happens.
About it. Now you need to put a conscious effort into not rating yourself, but continue to rate your behaviors as helpful or unhelpful. I'm not saying that, stop rating your behaviors, start becoming careless. No. Rate your behaviors, rate your attributes, whatever you have, but not self. Self is like too heavy to kind of, rate. We're going to work on a little more in the next session, probably. But why don't you do one practice in this week? Dig out all the incidents from past where you lost control.
Okay.
First, beat yourself up for that. Yes, I mean, like, it makes you happy, whatever. And then ask this question to yourself. I lost control a number of times. Right? It's not the first time I lost my control. How does it? And next question you may.
Sorry. Can you say that again? So I lost control a number of times. How does it?
How does it make me handicapped and not a human being who lacks a skill?
Okay.
Yeah. And another question you might ask yourself, can you write this down?
Sure.
How does beating myself up help me master a skill of managing my reactions better? So it's like, a parent who is hitting their child for failing in a math exam. Instead of sitting with them and, teaching them how to solve a math problem, like with a bum, do you think that this child is going to learn how to do math better?
And the question is rhetorical in itself, right? I mean, it's...
Yeah. It doesn't help you at all. So we get fooled into thinking that guilt is essential for improving. It is not. It's absolutely useless.
I actually accept that. I then end up feeling guilty about feeling guilty. You know what I mean?
Yeah.
It just... I've been conscious about the fact that this guilt, this feeling an inability to kind of get over it,
no problem,
is actually drag me down further. But
the problem was substitute emotion. You did not know of a substitute emotion. You believed that either I feel guilty or I feel nothing about it, which is shameless. And I can't be careless. I can't be doing this. So the best way is to feel guilty. So guilt served an advantage or served a purpose for you. But now the same purpose can be served by responsibility without feeling guilty, right? Does this make sense? Okay.
Excellent. Yes. It does.
Anything that did not help in the session?
No.
All right. Okay. So what's the take-home message then?
That I be a little more forgiving to myself and rationalize what's happening rather than blaming myself. Just not carrying guilt, but being a little more aware of what I'm doing and why I'm doing it. And it isn't necessary to beat myself up about it, but to just think about it a little more impartially, if I can say that.
So I'm going to help you with more skills in the subsequent sessions, and you may, because you're human, right? But you're a fast learner, so you may still make mistakes and not being able to manage guilt also. But that's very understandable. So with repeated practice, I'm sure that you are able to, but you will probably do much better subsequently. Thank you, Chaitrali, for the wonderful session. And now the forum is open for questions. We already have a few questions here.
Thank you so much for
you're most welcome.
For giving me a different perspective also, to this.
This is my job. All right. Okay. So is guilt a bad feeling? This is a question. No, it's not a bad feeling. It's unhelpful. It's unhealthy. It's dysfunctional. It doesn't serve a purpose of what it is supposed to be. It is natural to feel guilty, but it is not helpful. Another feeling, which is responsibility, is much helpful. Thank you. Okay, thank you very much. Questions, please. So we have Surabhi who wants to ask a question. Just a minute. Let me allow all of you to unmute yourself. Okay, Surabhi, you may unmute yourself. Surabhi, are you there? Okay, so Komaraju, would you like to unmute yourself and ask the question?
Yes, definitely. Okay. Can I talk now?
Yeah, Surabhi, you're on mute.
I have, so when you feel responsible, would that change your reaction over a period of time?
No, unless you act differently.
So when you want to act differently, you first have to change your thought process.
First, you have to change the feeling. And for changing the feeling, the changing thought process is essential.
Okay.
So, thinking comes first. feeling follows and a behavior follows, right? So if you change your feelings from feeling guilty to responsibility, which means that you have done a change in your cognition, your thinking, and then you may choose to behave differently after you feel different.
Okay, so first comes the change in your thinking, and then your feeling changes. Okay. And the second thing is, during the counseling session, is it okay to share your personal story with the client?
Yeah, we call this self-disclosure, and self-disclosure should only be done with the purpose of helping the client and not to brag about yourself. So make sure that self-disclosure is done sensitively with the understanding that, it is helpful to the client. Not all self-disclosure is helpful or done with an intent to help the client. Sometimes I have seen therapists brag about themselves. And
is it for the bond? Is it for the building of the bond?
Sorry?
Is it to build the bond or what?
Not necessarily build the bond, but to self-disclosure is to help the client understand that, I'm human, she is human too.
Okay, so you were experiencing the same symptoms which he had or she is currently facing. Something like
I made the same statement about human in multiple ways.
Correct. And the third thing is, you did mention about the REBT books. Can you please repeat?
Yes. Okay, I'm going to tell you the Practitioner's Guide to REBT is one book, and another book is Life Coaching by Wendy Tridon and Michael Neenan. Practitioner's Guide is by Christine Doyle, Raymond de Giuseppe, Wendy Tridon. So Practitioner's Guide to REBT, third edition. And this is for therapists, and for non-therapists, one of the best books is Life Coaching by Wendy Tridon and Michael.
Thank you so much, sir. It was an amazing session today. Thank you.
More questions, please. This would be live on, this is live on YouTube anyway. I'll edit the video and post it again tomorrow on YouTube, so it would be available for everyone to view.
Sir,
questions?
Please, sir. Next question. I am ready to ask a question.
Sure.
Yeah, sir. Like in one session, you have showed her that she has some false beliefs or irrational beliefs or whatever. I agree to that. REBT was excellent.
Oh.
Only thing, only thing my doubt is, suppose I am your client. In this session, okay, you showed me that my belief is wrong. How long will it take for me to change my belief to a rational belief and then consciously act upon that belief, which will help me to get out of my depression about depression?
You never know. Sometimes clients start acting differently right after the session. And, the level of adversity that triggers them again starts going up. So, she might be triggered by a small adversity today, and maybe a higher level intensity of adversity would trigger her, and then maybe a higher and higher and higher. So if she consciously puts in effort into revising, the process of questioning is very important. It's not just replacing the irrational ones. Process of acting differently, something that hardwires the new neural pathway in the brain, and it's highly variable. So some people master the skill pretty well, and
quickly
take a little bit more time.
Yeah, thank you, sir.
Sir, I have a question. So in this case, or in other case, like if you lose the control over something, so suppose you are showing anger, so doesn't it? It's not like कि उस situation का भी तो एक बहुत बड़ा role play है, या उस सामने वाले person का भी एक role होता है कि वो आपको कितना trigger कर रहे हैं. Isn't it the role of other person and the situation?
So now when you will replay the video, I want you to watch very carefully. Did I dismiss the role of A or the adversity or the event? I did not dismiss the role, but I said it is futile to keep thinking about event as the causation of your guilt. So the mediator is the thoughts, and that is what made her primarily guilty, right? And ugly beyond, you can't control them, and that's why we focus more on the B under your control. Does that answer your question?
So we should not be focusing upon the situation. Rather, we should be focusing upon our reactions, our thinking, and our own beliefs.
Right.
All right. Thank you, sir.
You're welcome. Right. Questions, please. I think the utensils want to ask some questions.
Hello.
Yes. Hi.
Yeah, sir. Thank you for. During the session, you asked her once, how do you want to feel about depression? And then you gave her three options: feeling nothing, feeling sad but not depressed, and feeling depressed. So, can we apply these, like this form of questioning to almost every emotion that the client, every irrational or every negative emotion that the client is feeling?
We can, because this is also important, because clients have dichotomous thinking. They think that either they can feel only dysfunctionally about it or feel nothing about it. So they hold on
Right.
to the dysfunctional emotion because it serves some purpose to them. For instance, guilt keeps reminding them of the pain they go through of guilt, that this is not acceptable, so you shouldn't do it. So sometimes it works. But I often give this example that if you want to run a marathon race, then you have an option to run with a 10 kg bag on your back, and you can also run it without it. So which one would be better?
Right.
Okay, fine, I don't want additional weight. So in a similar way, guilt gives you that additional weight, and you don't have to carry that weight. You could simply be responsible and not guilty.
Right. Okay. Thank you.
You're welcome. Okay, so I think we have Tahreen who wants to ask a question. Go ahead. Do you want to ask a question, Tahreen Saeed? All right. Okay, so I think this is all questions that we have today. And I thank all of you to join for joining, and I'll see you guys tomorrow.
Excuse me, but can I ask you something about yesterday?
Yes.
Something that you had mentioned?
Absolutely.
You had mentioned that there were two kinds of negative emotions, if I'm right. I'm sorry, but I didn't get that bit.
Okay, there are two types of negative emotions. One is healthy negative emotion, and another is unhealthy negative emotion. So
Okay.
guilt is an unhealthy negative emotion, whereas responsibility would be a healthy negative emotion. Similarly, anxiety is an unhealthy negative emotion. Concern is a healthy one. Sadness, depression and sadness, unhealthy anger, healthy anger, unhealthy envy, healthy envy, unhealthy jealousy, healthy jealousy. So shame, disappointment, hurt, disappointment. These are healthy and unhealthy negative feelings.
Okay. Did you mention that regret is healthy?
Regret is healthy. So
how does that?
I usually use the word regret, responsibility instead of regret.
Okay.
Regret does not. Regret means the same thing, which is I own up my mistake, but I'm not a bad person for doing
it. So it's all about not labeling yourself.
Yes.
Eventually.
The irrational belief is something that differentiates unhealthy negative emotions from healthy negative emotions.
All right. Thank you.
You're welcome. Right. And there are
more questions, sir. Please.
3 more aspects of emotions that define whether the emotion is healthy or unhealthy. All right. Okay. Vatsala says persistence of being focused was highlighted. Great. Are more sensitive people more prone to depression? No, not really. Emotional sensitivity and irrational beliefs are two different things. So someone may be sensitive and rational at the same time, whereas someone can be insensitive and irrational at the same time. How to deal with clients who say they have imposter syndrome? Yeah. So Vidula, this question can be answered by zeroing down into any of the unhelpful behaviors they could be doing, or unhealthy negative emotions they could be experiencing. So instead of treating the imposter syndrome, go with set an agenda for a specific feeling or a behavior, and then you'll be able to reach the core belief. Usually for imposter syndrome, people with imposter syndrome, depreciation is the belief that is at the root of it. What is the difference between counseling session and REBT session? Yeah. Counseling is a relationship between a therapist and a client where they decide to work on a problem, whereas REBT or psychotherapy is the treatment of psychiatric and psychological disorders with talk therapy. So the treatment of disorders differentiates counseling from REBT and psychotherapy. All right. Okay, so I think I have answered all the questions. Forum Lalka, if highlighting two different standards set by the client brings up feelings of deep-seated self-doubt, would that divulge us from the goal setup? If yes, how do we navigate from there? Keep a watch on what the client says, and the session feedback is a very important part of the session. And once you ask them what was unhelpful, and if the client mentions that this is what was unhelpful, immediately address it, and you can get back to the session goal. And if one strategy fails, for instance, do you see there is a double standard? Now, this was a logical strategy. Now, if this fails, then quickly switch the strategy to pragmatic, which is, how does it help you to call yourself handicapped instead of calling yourself human? So strategies do backfire, but don't get flustered by them. If there is a failure of strategy in the session, quickly shift the strategy. All right. Thank you very much, everyone. So I'll see you guys tomorrow again.
Sir, one question, sir, please.
Okay.
I'll not leave you, sir. Sir, I wanted to ask, does RECBT help each and everyone? Or should we, see, I am a counselor, so I get people, but I think it is not suitable for some people. For some, it is very, very, it's excellent.
So we do not say that RECBT or CBT is helpful to everyone. There are a set of people who are not ready for CBT or REBT. Specifically, people who do not want to take emotional responsibility. They would go for other therapies where they can vent out, they can blame the external environment or their past for what has happened and not take responsibility to change. So RECBT is not suitable for people who do not want to take responsibility of change. So this is very clear. RECBT may not be useful in certain disorders, especially if there is an active psychosis or if there is a bipolar disorder in the manic phase. RECBT may have very limited applications, but we have sufficient evidence that CBT and REBT are helpful in a variety of psychiatric and psychological problems. So give it a fair chance, do the assessment properly. And again, REBT does not work. The client has to make it work for them.
Yes. Thank you very much.
You're welcome.
Thank you very much.
Okay, thank you everyone. And I'll see you guys tomorrow at 7 o'clock.